One day, halfway through my medical career, I found myself in a dark forest, for I had lost the right path. That day was October 7th, 2013. It was a Monday. I was driving to work, to the clinic where I was the medical director, and my clinic manager called me to say one of our clinicians had not shown up for work. It was very unusual for that clinician, and he had a full schedule of patients. We had to manage those patients and try to find out what had happened to him. By the end of the day, our worst fears and nightmare became reality. We had lost a colleague and a friend to suicide. I've done since then what many of us do. I've asked myself, what could I have done to prevent that? What could I have said to change that outcome? What should I have noticed? Now, I'm not going to tell you today that burnout was the cause of that suicide. A tragedy like that has many factors in it. But when you look at all these factors, I know for a fact that burnout was one of those factors. So if we could have changed that one factor, I keep thinking maybe we could have changed that outcome, and we would not have lost a colleague and a friend, and so many patients would not have lost a great therapist. Now, burnout has been defined with three elements. The first is a sense of exhaustion. It's a physical response. You feel that you're drained at the end of the day, that you've given more than you've taken back. The second component is this cynicism. You don't believe in what you do anymore. You've lost that sense of purpose. The third is a sense of inefficiency. No matter how hard you work, you'll never have a sense of being done with work. Now, research shows that when we look at the healthcare workforce, the numbers are staggering. Between 1 in 3 or 1 in 2 of healthcare workers, including nurses, physicians, pharmacists, exhibit signs of burnout. 1 in 3 or 1 in 2. Think about this for a moment. When we compare that group of people to those without burnout, the burnout people are more likely to quit working in medicine altogether, working part-time. They have more medical errors. They have less patient satisfaction. They also have more depression and have more anxiety. And some of them have higher risk of alcohol and drug use. We also know another factor. Burnout is affecting younger generations more than older generations. So when we look at the prevalence of burnout, it's higher among those in their 20s and 30s than among those in their 50s and 60s. When you think about how the population is shaped today, we are facing a retirement along with a workforce that is coming to work part-time. We're not ready for it. It is a real crisis. Now, in our work here at the University of Arkansas, we have learned some interesting facts about burnout that I want to share with you. We found a factor that is strongly correlated with burnout risk. Those that had a lot of this stuff, they are rarely burnout. Those that report having this rarely or never, their odds of burnout are 19 to 1. That factor, if I could, I would prescribe to all of you, is meaningful work, is finding meaning in what you do. Now, by now, you may be thinking, oh my God, that's one of those meaning talks that psychologists and psychiatrists like me have been talking about for decades. Even worse, you may be considering this is the meaning stuff that philosophers have been talking about for centuries, and they cannot agree on a definition on how to measure it. So I'm going to give you 4 tools that I found useful to look at meaning. These 4 tools I am taking from the work done by Emily Esfahani-Smith, and I believe they can help us reshape healthcare. The first way to look at meaning is actually belonging. Where do you belong? We human beings have this deep need to belong somewhere. What does it mean to belong? You belong to a place when you find a group of people that care about some shared common interest with you. I'll give you one example. If you go around Arkansas, you see a lot of little angry red hogs. They are everywhere. They are in car stickers, bumper stickers. They are in mugs. They are in T-shirts and sweaters. What is it about Arkansas that people care about these little angry red hogs? This came home to me about 10 years ago when my daughter was 4, and we went to Texas. And we are in Texas, and she sees somebody coming in with this little angry red hog in a T-shirt. And my 4-year-old daughter called the hogs in Texas. So, if you are from Arkansas, you know you belong here when you start caring for these little angry red hogs. They represent our beloved college football team. No matter how the team is doing, we love them. Belonging in healthcare means that you have a sense of being part of a team, of people that care about something called taking care of others. That is the definition of healthcare. You belong here. You have made choices, and you have worked hard to be where you are. And it is important that we make a sense of belonging part of healthcare. The second component of meaning is the obvious one. Meaning has to do with purpose. Purpose is a long-standing goal that you're working towards. The purpose of healthcare, and I'm going to surprise you today, is to care for people. Healthcare started thousands of years ago when one of us, one human being, was sick, was injured, was suffering. And another human being decided, maybe I can do something to help this person. That's how healthcare started. That's the core of healthcare, is to take care of each other. The purpose of healthcare is not to write notes. The purpose of healthcare is not to type. Sometimes in physician groups these days, you see this message which says, I trained to be a physician, now I'm a typist. Physicians are spending more time typing in their computers than talking to their patients. That's not the purpose of healthcare. Our organizations should not make this a barrier to our purpose of taking care of each other. It's very important that we take this back. Because if we don't, we have the risk of burnout and all the consequences that we talked about. Because the other thing about burnout is that we know today that we're going to address burnout with a combination of individual-level interventions and organizational change. We need to be pushing for both. And I believe meaning is a way to think about both sides. The third side, way to look at meaning is actually to consider stories, is storytelling. Now, we humans, we have been telling stories for thousands of years because that's how we make sense about being in the world and being aware that we are in the world and that the world existed before we came here and is going to continue to exist after we're gone. We tell stories to each other. People that study stories, they tell us there are two types of stories. One type of stories are contamination stories. Contamination stories, they go like this. I was born, I was going about living my life, something happened to me, and now I'm broken. I'm no longer what I was supposed to be. I heard those stories from my patients with post-traumatic stress disorder. That's what it feels like. It's a contamination story. And by the way, PTSD is real. And patients with PTSD deserve care and deserve attention and deserve the treatment. Now, when you look at trauma, though, there is another side of that curve. There are people that have the other type of stories, and those are called redemption stories. Redemption stories, they go like this. I was born, I was living my life, something bad happened to me. I wish it had never happened. It was bad, it was tough. After it, though, I'm a different person. I've grown. They exhibit what's called post-traumatic growth. And it's interesting, it's very telling that psychology and psychiatry for hundreds of years now have looked only at PTSD. And only for the last 20 years, through positive psychology, we are starting to understand the other side of this curve of post-traumatic growth. We always looked at contamination stories. We are starting to understand redemption stories too. These stories are important. And in healthcare, we have amazing stories of how we became who we are and how we came to be the professionals we are, physicians, nurses, pharmacists, and the whole team of healthcare. The fourth component of meaning, the fourth tool I'm going to give you, is actually a tricky one, is transcendence. Transcendence is tricky because for a lot of people, transcendence goes along with religion. And if you get transcendence through religion, that's great. Transcendence is the sense that you are connected to something bigger than you. That's exactly what religion means, from the term in Latin, religare, which means reconnect. Religion means to reconnect you to the bigger universe, to something bigger than you, is a sense of transcendence. But even if you don't have religion, transcendence is important. We should never lose the sense of being in a transcendent universe. You get transcendence through art, through music, through poetry. You do through relationships. We need not forget that medicine and healthcare is full of transcendent moments. I remember as a medical student, the first time I helped a woman have a baby. It's a very transcendent moment when somebody is being born. I remember my attending telling me, this is special. 4 people go into the room and 5 people come out. It's unbelievable. And every medical student will tell you they remember that day. You're also going to remember the first time you see a patient die. I remember looking around the room, and me and my healthcare colleagues are the only one in the room when somebody's dying. They are not family members. We are invited to be there. We are invited to be in these transcendent moments of people's lives. So, the 4 tools I'm sharing with you today are a sense of belonging, are a sense of storytelling, purpose, and a sense of transcendence. If I could talk to my friend again, I would try to have that conversation with him and remind him that he belonged with us, he belonged in our clinic, taking care of the patients, he belonged to his family, he belonged with us. We wanted him, we cared for him. We also would share our stories. I would have shared stories with him of patients we had in common, of options and choices we've made to become colleagues in this team. I would share with him our purpose of taking care of other people and remind him that that includes taking care of each other. And I would try to remind him also of these transcendent moments that we are invited to be present as healthcare providers. He was an amazing therapist. I heard from many patients how good he was. And we lost him. So I hope that by having these conversations with these 4 tools, we can take meaning back to medicine. If we work together to bring meaning back to healthcare, to prevent our organizations from putting barriers between what we do and the meaningful work we're here trained to do, I believe that through the power of stories, individually or collectively, by remaining centered on our purpose of taking care of people, we will have better individual level interventions and better organizational change. In the process of doing that, not only are we going to decrease the prevalence of burnout, but we're also going to create a healthcare system that we're happy to belong to, that we're happy to work in one system where our patients get the care they deserve. Thank you.